7:43, there are new exercise guidelines for the first time in 10 years. Dr. Chaffoo is here to break it all down for us. We were sharing the story earlier that many of us are not even getting the exercise that we're supposed to be getting.
We really aren't, Shally. You're exactly right. You know, only about 26% of adult men, 19% of adult women, and 20% of adolescents are getting enough exercise. You know, researchers tell us that that probably results in 10% of a premature death rate increase in the general population. So it's definitely become a significant health risk. We're seeing that an average of probably over $100 billion a year in healthcare expenditures are directly related to people not getting enough exercise.
When we think exercise, we think we got to do it 5 days a week, 6 days a week, an hour a day. That's not necessarily true.
Exactly. You know, the most important thing, Shally, is to keep moving. And the guidelines have changed. So now, essentially, it used to be after the age of 6. Researchers are telling us in most countries in the world, it's 3 to 5. That preschool, at least active playing, is a very important part of daily exercise.
Yeah, those kids need to move their
Yes.
bodies, and then so do the adults. I'm embarrassed to say, Dr. Chaffoo, I look at my calendar, the first thing I usually have to cut is the exercise.
Right.
Like if the schedule gets too busy, how many of you do the same thing, right? You just cut
Of course.
it.
Absolutely.
But we can't.
We can't. It's so important, you know, certainly in adults, the recommendations now are we need to at least consider exercise 2.5 hours a week.
A week.
A week, at least that amount. And in addition to that, we need to do some strengthening because we want to strengthen our muscles, our bones several times a week.
Okay, I want to talk about more benefits of the exercise because they say that the older you get, and all of us are feeling it, it's like your
Right.
body changes and your
Exactly.
energy changes. What are some of the more benefits of exercise?
So, Shally, the benefits of exercise involve not only the neuropsychiatric benefits. We know we see people that exercise regularly have improved sleep, less anxiety, less depression. We also really see physiologically that regular exercise reduces our risk for serious illnesses like heart disease,
Yes.
type 2 diabetes, and at least 8 forms of cancer. It makes us feel more relaxed, not as stressed out.
No. And it helps with depression.
Helps with depression, and also there are some studies that indicate that it improves cognitive function. So what that means in adults is we may reduce the risk of dementia. It does help people that have ADHD, and certainly even people that have Alzheimer's, which is obviously a very serious illness. It does seem to improve function even in those individuals. So it does have benefits physiologically, both psychiatrically and physically.
So our big takeaway from today,
Yes.
especially as we get into the holiday season where we're stressed out more,
Right.
we're running around, the anxiety levels go up,
Yes.
is to find some time to exercise.
Don't cut it out.
No,
don't make it one of the first
Put it
things you eliminate.
back in my
Make it one of the
calendar.
last things you eliminate.
I know. I was telling somebody the other day, it's like my kids get exercise. They get it a few days a
Right.
week, but what about mommy and daddy?
Right.
So important.
Mommy and
Dr.
daddy
Chaffoo.
important,
We are
exactly.
very important.
Yes.
Dr. Chaffoo, thank you for being here. Always good
Good to see you,
you.
Shally. Thank you.
All right, 7:47, Mira Mesa High.